This morning, the Ministry of Public Health met with the Minister of Natural Resources, including the DCMO and the CMO of the Ministry of Public Health, along with Dr. Amir, the Director of Medical and Professional Services of the Georgetown Public Hospital Corporation, the CEO, retired Brigadier Lewis of the Georgetown Public Hospital Corporation, the PWR of PAHO, WHO, Guyana, and Minister's team, which comprised of Ms. Dion MacDonald and Mr. Frederick Gaspar. This meeting was called with regards to the mercury issues emanating from the GGMC and the Guyana Gold Board staff, but more particularly due to the issues that surround this particular problem, which emanated in the press, giving speculative information to the public without the documentation from the pathologists indicating that a member or a former member of staff died from the exposure of mercury. And so we want to set the records straight on that. But more than ever, the Ministry of Public Health sees it fit to collaborate with our sister agency to ensure that we can be able to provide guidance on this matter and to provide the technical skills needed for us to investigate, for us to determine the challenges and the gaps which are faced by these agencies and to find solutions for them.
Well, thank you, Minister. Just to say that indeed the Minister of Public Health, and I thank her for it, convened a meeting this morning with senior health officials and senior officials of the GGMC to discuss how we're going to manage this issue. It is, we believe, a matter that should be headlined or taken over by the Ministry of Public Health. Indeed, we have read many things in the newspapers. There's no data or any evidence to show that anyone has died as a result of mercury. At the same time, we are not going to ignore the suggestions or the calls, and so coming out of today's meeting, as will be, more details will be shared later, PAHO has been invited to have a team come into Guyana. We are also undertaking to share all the data that we have, not just from this year, but going back over a decade and before, because we were reminded by the Chief Medical Officer this morning that this matter has been an ongoing one for in excess of a decade. References were made to periods of 2005, 2006, and coming forward. So I believe that today's meeting will lead to a better management of the issue, a better handling of it, and ultimately, as the Minister of Public Health said this morning, we wish to restore confidence both in the workers and in the public that this issue is being addressed. It cannot be understated as well that we will need the support of the miners. It is not the government, it is not the GGMC or the Guyana Gold Board that use mercury. It is the miners who use mercury, and there are people who import mercury illegally to support this trade. And so the President himself is committed to seeing the eradication of mercury and its use in Guyana. And we wish to support that, and we wish the miners to give support as well. So government's position is that no expense will be spared, no effort will be spared, as we've said before, to ensure that the well-being of every single worker and everyone who comes into contact with mercury, because there are people in the interior, there are people who do cooking, there are people who do farming, and others who may be affected knowingly or unknowingly. So I was pleased today to hear Minister of Health saying that even the Georgetown Public Hospital and other regional hospitals now have to develop the methods, the systems, the protocols for dealing with this, because we're not just dealing with a matter of mercury in the compound of GGMC. We have to look at it as a national issue. And so there is no evidence to say that anyone has died as a result of. At the same time, we're not ignoring any possibility, and this is why PAHO has been invited to send a team, and of course GGMC and the Guyana Gold Board and the government will cover the costs attending to that visit. So I'm quite comfortable with the Ministry of Public Health taking charge of the situation. We know that there's been much anxiety, and I, having worked with this minister in various capacities over many years, have every confidence that she sees the job through to the end, and that having committed, we're not going to just have some kind of superficial placating arrangement put in place, but something that is deep and comprehensive. And so I'm quite happy with the outcome of today's meeting, and looking forward to collaborating with the Ministry of Public Health going forward in the days ahead. Thank you.